To the folks who think this can't happen to me, to the people who just eat how they want to eat and they'll think they'll handle it later, I was 20 years old. And at that time, I was even misdiagnosed. They told me I had type 1 only because of my age. I really was a type 2. Hi, my name is Serena Valentine, and I'm living with diabetic retinopathy. Before I was diagnosed with diabetes, I didn't know too much of anything. I just knew that some of my family members had it. I heard about it, but I didn't know a lot about it at all. I was diagnosed with diabetes exactly November 29th, 2003. I was 20 years old. I remember that like it was yesterday. That was one of the scariest days of my life. My friend at the time took me to the ER and my blood sugar was 550. And the doctor asked me, "Did you know you had diabetes?" And I said, "No." He said, "Well, you have diabetes." It was 2017 when I started to lose my vision and I started having floaters and dark spots floating in my right eye. And I noticed it, but at the time I didn't have insurance to be able to go and get it checked up.
Diabetes is the leading cause of preventable blindness in the country. We have a large number of diabetics. So if you ask who's at risk for diabetic eye disease, pretty much any diabetic. It depends on how well the diabetes is controlled, how long the patient's had diabetes. But in general, every patient is at risk, and poor diabetic control leads to diabetic eye disease. Diabetes affects someone's eyesight because it affects the small blood vessels throughout the body. The eye has some of the smallest blood vessels in the body. These blood vessels get affected, so we lose blood flow to small blood vessels in the eye. We also sometimes get increased permeability. And what I mean by that is these vessels can leak. So fluid that is not supposed to be in the retina, it really should stay in the blood vessels, can leak into the retina, and that can cause problems.
I'd say I was going through those symptoms for about 3 or 4 months before I actually could go get insurance. That prompted me to go get it. I got it and they told me I had diabetic retinopathy in the right eye, and then slowly it started in the left eye as well.
When we talk about diabetic eye disease, the diabetes can affect the eye in several different ways, but the one that bothers patients the most is what we call diabetic retinopathy. So the eye works like a camera. Light comes in, it gets focused by the front part of the eye, which is the cornea and the lens, onto the film of the eye, which is the retina. So just like a camera, if you have problems with the lens, you can exchange the lens. But if you have problems with the film of the camera or the retina, then changing the lens doesn't matter at all.
So I had about 11 laser surgeries in my right eye. I also had a retina reattachment surgery because the retina had like halfway detached from the back of my eye. And after that surgery, 3 days after surgery, I woke up no sight in the right eye. At that time, my left eye was still okay. But as time progressed on through into the next year, May 2019, I started having vision problems with the left eye. And the retina was starting to detach from there as well.
One of the mainstays of treatment today are intraocular injections. So we know that these new blood vessels form or these vessels leak because there's a chemical produced in the body called vascular endothelial growth factor, which is we abbreviated VEGF. And this vascular endothelial growth factor encourages new blood vessel growth and leakage. Ultimately, if injections don't work and sometimes even in addition to lasers, patients will still bleed and we have to take them to the operating room where we surgically remove the blood, add additional laser. And sometimes we also have to repair the retinal detachment that I talked about during that surgery. So we have several treatments.
At the end of that month of May 2019, I was actually conducting the diabetes peer support group meeting. While I was talking, I blinked and couldn't see anything but light. My mother was there with me at the time. Sometimes she would come to my meetings just for support. And she was there and she was like, "Let's go, you ready to go?" And I was like, "Mom, I can't see." She's like, "What you mean you can't see?" "I can't see. I've got to follow you out of this building. I cannot see." So that's how that happened. And I stayed that way for 9 months. I went through a lot of emotional and mental anguish during that time. My son might have been about 8 or 9. And I was his sole caregiver. He's a special needs child with autism. He's nonverbal. I was used to looking at his facial expressions, watching body movement to know what was going on with him. At this point, I couldn't do it. Then I learned really quick how to listen to the tone in his voice, the noises that he makes if he was happy or if he was sad or upset or he was hungry and things like that. But the crazy thing about that was he helped me out a lot too. He walked me around. He would hold my hand and pull me. I'd say, okay, mommy needs to get in this building. So you got to help me. And so he just grabbed my hand and pulled me, and I followed him into the building a lot of times. But I did have some family support. The doctors at that time told me that it wasn't gonna get better. It was gonna get progressively worse. And what they wanted to do was at least keep me seeing light. So about February 2020, it was right before pandemic lockdowns. I'll never forget this. I of course, during that time, I was kept praying and hoping it was going to get better and hoping it was going to get better. One day I woke up and where I could only see light, I could see blurry pictures of certain things like my dresser, not clear, but I could see a figure there. I could see my door. I could see the floor. And I opened my eyes and I was like, I can see that. And I reached out and touched it. I'm like, okay, I'm not dreaming. Right now, the right eye is still completely blind. It's still dark, but the left eye have about 35% vision in it, and it's very blurry. Some days are okay, and other days are not so good. And I can tell it can change and fluctuate due to my blood sugar levels at that time.
When it comes to African Americans, you know, it's a place that's, I mean, dear and near to my heart. You know, we are undertreated, we're underdiagnosed. And so there's a big push to try to, by different companies actually, to try to reach out to the African American community. For years, I've gone to Prairie View to give talks to the community about diabetic retinopathy. There's a lot of outreach, and we don't know exactly why. There's probably a genetic component, but there's definitely a socioeconomic component. Like, these food deserts are real. The not getting the preventative care that we need is important.
With learning all the information that I have, and it's with the initiative I've been working with for about 6 years, right around the time I started my nonprofit. It's called Cities Changing Diabetes. It's a global initiative. And I started working with them right after I had surgery on the right eye. And then I started really feeling the space that I was in, and it gave me more passion to talk and open my mouth. So that initiative is the only one that I work with. I also work with Prevent Blindness, where they deal with all different kinds of vision loss. They also had a group of people who had diabetes as well with the vision loss. And so I do some work with them. I'm also an ADA Focus on Diabetes champion. So I told my story several times with them. And so this is how, it's how I got here. To the folks who think this can't happen to me, to the people who just eat how they want to eat and they'll think they'll handle it later, I was 20 years old. And at that time, I was even misdiagnosed. They told me I had type 1 only because of my age. I really was a type 2. The age is getting younger and younger. It's not just an older person's illness, is what I initially thought. And it's not true.
The best thing, though, is for patients to control their diabetes. Diabetes is, and I'll say it again, the leading cause of preventable blindness. So of all the diseases that blind people, it's the number one that we can make a difference in. I need you to control your blood sugars, lose weight, exercise. Those things have been shown to be very effective. And in combination of that and proper medical care, we can preserve vision in patients in a very satisfying manner.
Also, for the women who have gestational diabetes during pregnancy, some of them think, okay, after I had the baby, I'm good. I can go back to, no, now you're at higher risk to have onset of type 2 later on in life if you do not take care of your body. You're at higher risk than even a person totally without diabetes. My motivation comes from a list of things. So my family, particularly my mother and my brother, were my biggest support. They would always tell me, oh, you're gonna get some of that vision back. My child motivated me. He's as tall as me now. Now, when I lost my vision, he might have been up to maybe my chest. And when my eye finally opened up to where I could see, he was taller. And it made me cry because I was like, oh, at least now I can see how far you've grown. And, he's growing up to be such a handsome young man. And I'm grateful for that. Also, the people that I help motivate me, because if they didn't have someone telling their story, they would still feel like everybody understands, and they wouldn't have a message of hope. My purpose is to share a message and a picture of hope. If you get a complication, believe, well, I'm doing bad if I get a complication. You may be doing bad at that time, but you can still get better.